Buckle up, nerds. We need to talk about Ebola. You may have seen the headlines about a growing Ebola outbreak in the Democratic Republic of Congo, or the DRC, and Uganda. Both are in Africa. And if that sounds scary, that's understandable. Ebola is a serious disease. Ebola outbreaks make for great movies and books because they can spread and kill a lot of people. So let's cut through the panic and the catchy headlines and break down what is actually happening. The most important thing you need to know right now is that if you live in the United States, or really any place outside of this area of the outbreak, your risk is extremely low. There is an outbreak of Ebola disease with over 1,000 suspected or confirmed cases and more than 200 deaths. The outbreak is caused by Bundibugyo virus and began around March in the DRC, near the borders of Uganda and South Sudan. Unfortunately, this outbreak is likely to get a lot worse before it gets better. I mentioned Bundibugyo virus, but what is that? Bundibugyo is one member of a family of related viruses that we call Ebola virus. The fact that they're different viruses is important. We have some vaccines and monoclonal antibody treatments for Zaire Ebola virus. That's the one that caused multiple large outbreaks over the past few decades. But there are no specific approved vaccines or treatments for Bundibugyo virus. That's scary. But the good news is that Ebola does not spread easily. Ebola usually spreads among caregivers, family members, or healthcare workers. It does not spread casually in public spaces because it's spread through direct contact with bodily fluids from someone who is sick. These are things like blood, vomit, diarrhea, saliva, or contaminated things like needles or bedding. It can be hard to tell if someone has Ebola or is just sick with a general virus because viruses cause similar symptoms early in infection. Things like fever, fatigue, muscle aches, headaches, and sore throat. The difference is that people with Ebola become severely ill very quickly, with vomiting, diarrhea, and sometimes bleeding. That's why you may have heard this called a hemorrhagic disease, because hemorrhage means bleeding. Without vaccines or effective treatments, the way we stop outbreaks like Ebola is to get rapid testing in place, isolate sick people, and trace contacts so that they can be informed and quarantined. Treatment includes things like fluids, electrolytes, and sometimes intensive medical support. But even with this treatment, this virus can be very serious. Past Bundibugyo outbreaks have killed up to half the people who got sick. That's why we need to stop this outbreak. That's where the World Health Organization, or the WHO, comes in. They're on the ground, actively monitoring and responding to contain the outbreak. It's difficult work because this part of the world is experiencing significant conflict and is very rural, making it difficult to reach those affected by the disease. To help with the efforts, the WHO declared the outbreak a public health emergency of international concern, or FAKE. Boy, do people love a good acronym. That declaration helps coordinate international surveillance, testing, and outbreak response efforts across the world to keep us safe. So what can you do to protect yourself? Stay informed, but don't panic. Avoid travel to areas where there's an outbreak and follow general good hygiene practices, things like washing your hands regularly. And don't touch bodily fluids from people who are sick without protection like gloves. The bottom line is Ebola is a serious disease, but it is not easily spread, and public health systems are actively working to contain this outbreak. We'll keep watching the science so you don't have to doom scroll.